All right, good afternoon, everybody. Daniel here again, and like always, I'm here to enlighten you about ultrasound. Mm, so we live in Nigeria, and actually in Nigeria, plenty people do what we call self-diagnosis, and that is bad. It's very, very bad, in the sense that in most families, whenever somebody starts running temperature or has headache, the mom or the dad will say, "Oh, it's malaria. Let's go and buy malaria medicine and give to the person." Sometimes it works, sometimes it doesn't work. And so we've also carried that into the world of ultrasound, where any pain that is radiating in the right iliac region will be termed as appendicitis. But that is not usually true in every case, because there can be so many causes of the pain that you can have in your right iliac or your lower abdominal region. It could be anything from an ovarian cyst to a pelvic inflammatory disease, or to maybe a hernia, whatever the cause can be. It can be any of these things. So one thing that you must not do as a patient or somebody who is taking care of a patient or an individual is to quickly assume that any pain you have in your lower abdominal region is appendicitis. First of all, there are clinical symptoms and there are clinical correlations to these things. So you don't really have to assume until you run a proper diagnosis of your disease condition. So here at St. Mary's, we do appendix ultrasound, where we find out if the appendix is actually inflamed, and how it will appear most times on the normal ultrasound. If it's appendicitis, is that it's going to appear like a target sign. For example, if you change the orientation of your probe to either longitudinal or transverse, depending on where you are, the location where you are going to see that the appendix will assume a target sign. So if it assumes that target sign, then you can safely say that, okay, the appendix is inflamed. Now that is the most basic form of what you can see to assume that this is appendicitis. So until that scan is done, you should not assume that what you are experiencing, or what your child or your relation or your loved one is experiencing, is appendicitis. So you should come run a scan first to find out if it is appendicitis. So here at St. Mary's Hospital, we always have that opportunity where we conduct this kind of scans for patients. So if you're having such pains in your lower abdominal region, we encourage you to come around and have yourself diagnosed, so you can know properly exactly what is wrong with you. So don't make assumptions, come and be double sure. So until next time, I will catch you again. Bye bye.